and fat. And also they are, of course, encompassed in skin. After weight loss, the breast can't sag because they will lose volume. If the skin has been stretched due to a certain amount of volume and loses that volume, the natural occurrence is that the breast will drop. Different breasts drop in different ways. It's important during the assessment, during the consultation, to decide what is the best surgery for you. I try to minimize scars as much as possible. In some cases, just the addition of an implant or fat injection may be just enough to reverse the drooping of the breast. So the breasts are a very sensitive part of our body, and it's very difficult to get good results with non-surgical treatments. There have been reports of doctors injecting fillers or using threads to lift the breast. However, in most cases the results can be disappointing. The best candidate for breast lift surgery is any woman who has lost either volume or elasticity of the skin of the breast and would like to get back the youthful appearance. Breast lift surgery can have a wide variety of different techniques. It's very important for the surgeon and for myself, when I see you in consultation, to evaluate exactly what needs to be done with the most appropriate technique, which will be the one that requires the least surgical intervention, and that means the smallest scars. Often a breast lift might actually be better suited to be combined with a breast augmentation. A lot of times, if the breasts have lost a lot of volume, a small addition of volume or a larger amount of volume may help the breast look better and may assist them in the lifting process. In this situation, we will combine a breast lift with an implant or with fat injection. So the scar can be placed in different areas according to the needs of each patient. If all a patient needs is volume, then an incision might be just necessary for an implant to be inserted or for fat injection to be injected in the breast. In that case, for the implant, usually the incision is under the breast, what we call inframammary fold, and in the case of fat injections, it's just an injection site, which is very, very small. Usually though, if a breast lift surgery needs to be done, it will require an incision around the areola. That can be done as a semicircular line from 3 to 9 o'clock, or like a full circle. This is what we call periareolar incisions. In cases where there is a lot more skin to be removed, this periareolar incision is to be combined with a vertical incision from the areola to the inframammary fold. This is the lollipop incision. Finally, if more skin needs to be removed, the lollipop incision needs to be combined with the longer inframammary fold incision, and this is the anchor scar. A lot of patients ask me if the cup size will change during breast lift surgery. Well, that depends. If you require a cup change, we can discuss about making the breast either smaller or bigger, or if we are happy with the size, then we can maintain the same cup size. So it's a matter of preference, and it's a matter that you need to discuss with the surgeon during a consultation. I recommend wearing a supportive bra after breast lift surgery for a period of up to 6 weeks. In the vast majority of breast lift surgery, women are able to breastfeed afterwards. However, there are some techniques or some variations of techniques that actually can interfere with breastfeeding. It's very important to discuss this with your surgeon before surgery. after breast lift surgery usually involves the first week, which is the time after which we remove the stitches. And after the first week, most women can be able to go back to some of their activities and to work. However, it would require around 6 weeks before scar starts to fade, and at some point between 6 weeks to 3 months, the breast will settle in the more natural position. There are times where nipple sensation may be affected. This is a very low occurrence, I would say around 3%. In these cases, women may need to wait for weeks or months for the sensation to the nipple